Oh, there she is. Hi, everybody. Thank you for joining the Q&A today for reframing the narrative, how one state changed focus from services and programs to systems and families to address future needs during a crisis. My name is Eve. I'm joined by my coworker, Salame, and we are going to answer some questions for our, we didn't see any come in through the chat. So if you all have any questions for our speakers, feel free to throw them in the chat here and we can get this started. I'm still letting some people in, so it might be another minute or so. Speakers, do you want to introduce yourselves?
Sure, I'll be glad to start. I'm Carla Snodgrass, and I'm excited to be here this afternoon. I'm the Deputy Director for Child Health at the Department of Health.
And I'm Jacqueline Johnson. Can you hear me?
Yes, we can hear you.
Okay. I'm Jacqueline Johnson. I am the Children, Youth with Special Healthcare Needs Section Chief for the Tennessee Department of Health as well. And that's where CHANT resides in that section.
Hi, I'm Leilani Spence. I'm the Deputy Administrator of Maternal Child Health at the Shelby County Health Department in Memphis, Tennessee. And I manage a CHANT program here at the local health department.
Thank you all for being here, and thank you for the important work that you all are doing.
Thanks. Jackie might want to tackle the first question in the CHANT if she can see it, because she was there from the beginning with developing the timelines on developing CHANT.
Yeah, and just for folks coming in, the question is, how long did this idea take to come up with and then implement?
And so I believe we're talking about CHANT as a whole. We started working on an integration model back probably in 2000, I would say 14, 15, where at that time the department had two programs. One was Children's Special Services, which is our Children with the Special Healthcare Needs program, and the other one was our HUGS, Help Us Grow Successfully, which was a departmentally formed program that provided services to prenatal, postnatal women, and then children 0 to age 6. And so due to some early funding cuts from our state budget, we started then looking at how to integrate those systems, because oftentimes we would have the same persons going into the homes working with the families, depending on whether it was a child with special healthcare needs or whether it was a child 0 to 6 or a pregnant, postpartum, or prenatal, well, a pregnant woman. And so so from 2015, I guess 14, 15, we just kind of sort of played around with the idea. And then in 2016, 17, we were kind of handed a mandate to get it done. And in 2018, it came into fruition. It was like we hired a new deputy director, and that person's sole responsibility at that time was to ensure that CHANT, that the integration occurred. And during those years, we not only had the two programs that were already identified, we actually added our Tender Care Outreach program, which was just a state Medicaid funded initiative where we had outreach workers that went out to do some working with families to try to make sure that they got in for their well child checks, immunizations, and those kinds of things. And so now we had the three programs to kind of braid. As far as burdens, as with all things new, there were always also burdens within, not only within central office and just trying to make that change. There were lots of challenges in the field staff, because you have three distinct programs with distinct service models. One very, very stringent rules and regulations based on the fact that it has statute that's been on the books since 1919. And so trying to fit those models together, serving different populations, And it just became somewhat challenging. And then, of course, the difference in employees' knowledge, skills, and abilities, education, all of that. So we went through a lot of that. There were some challenges, Carla, you will remember, with some interpersonal skills within teams, within the local health departments and things like that. So training was required. But as far as the funding is concerned, because we pretty much oversee, when I say we, I mean the central office team, we pretty much oversee the funding. So we were able to pretty quickly, with the help of our fiscal officers, pull the funding sources together. And we still somewhat remain a little bit disjointed from a funding perspective, but that's simply because of the way we report funds, the way funds come in and those kind of things. So that part, I guess, was probably less burdensome than some of the other activities that occurred during that time.
And I was going to say, Leilani, you may want to speak about those challenges you face in Shelby County, which is their largest program in the state.
I think, yeah, this is Leilani. I think Jackie spoke very eloquently on some of the challenges. We were the first metro, I believe, that piloted the program. Probably the largest chant program from the initiation of the program. So I think what Jackie said is true. We had a problem. We had concerns of rating, not only the funding, which was not an issue, but just bringing skill sets from totally different people, people who were solely only wanted to do children with special health care needs. Now we had to educate them on different skill sets, on learning about prenatal and safe sleep, and the hug staff, who were basically focused on moms and babies, who basically did very little with children with special health care needs. We had to educate them. And then we had the outreach staff that's all they did, was just doing outreach, and did an excellent job of it. But now we're teaching them care coordination skills, and they had never had care coordination skills. So it was a matter of just doing a lot of education, a matter of morale boosting. We here in Shelby County, we had a meeting every Monday just on team building, and just trying to build the team, and just trying to be inclusive with what we were trying to do, because everybody in their own sector, whether it was TCO, which was Teen Care Outreach, CSS, or HUGS, they each thought that they were the most important program. Now we're one program, and we had to bring them together, and even with the leadership, it was different. Here in Shelby County, we started with 3 supervisors, 3 managers, and once this program got off the ground, all 3 of them left me. They retired. So I was left by myself trying to figure out how to braid the program. So change is difficult for many people, and so we had to learn about change management. So we are still learning, still going through our processes, and but I do feel the chant is one of the best things, one of the best programs that we have. It does ensure that we are addressing health equity, infant mortality, and children with special health care needs.
Thank you so much. What an amazing answer. We had another couple questions come in through the chat box from Victoria. What were the burdens? Was there anyone that needed convincing or challenges with joining the funding streams?
I'll kind of take that for just a moment. I think the hardest thing for us is helping those who aren't directly involved every day with chant to realize the value of it. So we have regional directors across the state, and they were a bit removed from it. So all they saw was we had changed their programs around and changed their people around, and why did we do this? And how was it going to be? And our best cheerleaders for that change were the chant workers themselves, coming back in, sharing stories of changes they've been able to implement with families. But it wasn't easy. And I think those regional directors who were managing regional monies were more concerned about how funding and how staffing were going to be.
Will you elaborate on the emergency preparedness toolkits for families?
Sure. So like I said, before the pandemic, we had a major row or I guess I can't remember how they term it, but we had tornadoes across the state, and especially within our Upper Cumberland region. Several of those counties were affected really, really bad, like even from where I live on up to the 40 corridor, we call it. And so I actually, and Carla as well, went out to do some disaster relief preparedness at one of the sites to help families get information. And we realized that there was nothing there. I mean, TEMA was there, of course, and so they could provide resources of that way. But as far as families knowing about making an emergency plan and doing things like that, and while we had talked about it, and in our care coordination checklist for children with special health care needs, we have a checklist that we talk about emergency preparedness, but we had never done any training or any real emphasis on how to prepare and what to prepare. So we came back, and I want to say it was Alabama or Mississippi that already had like an emergency preparedness, and they presented it on one of our calls. And I just kind of talked to them to find out exactly what they did, and we just kind of replicate it. And so it's a backpack, and within the backpack we have a waterproof document holder. We also have a care plan and an emergency preparedness plan that, you know, we work with families and try to get them to complete that plan before something happens, and then put copies of their, you know, their lease, their birth certificates, or their driver's license, those things that they're going to need when they're trying to get assistance when there is an emergency. So we try to get them to go ahead and put that in the waterproof document holder. There are things like masks and flashlights and hand sanitizer, and just a little emergency kit with you know, first aid kit with things like that. I'm trying to think, I'm sure I'm blanking on something, but and then like a battery charger for their phones, and so, but everything just so we can put everything in one place, and then maybe have it sitting in a specific place, so when something happens you can grab it and go. You already have everything there, and you don't have to worry about that. That's just one less worry when you get there. And so, and we also provided a resource card that has resources for families that, you know, for TANF and for food stamps or SNAP and things like that, so that they don't have to try to look that information up. It's right there at their fingertips, and they can just go through and contact those individuals as needed. So that's kind of the emergency toolkit.
And, you know, one of the barriers we ran into is this toolkit was exceptional. I mean, it was exceptional. And we wanted to also share it with our evidence-based home visiting programs, but because of our own procurement problems and our own ability to transfer money from one contract and one funding stream to the other, and something that wasn't mentioned, we were not able to utilize the funding we could have with evidence-based home visiting for this. But it was a remarkable toolkit, and it's something I think families can really use. And we've now written it into our next grant with EBHB.
That's good to know, Carla, because we got funding. We also got funding. So the initial funding was just from the Title V block grant. We then asked for funding from our emergency preparedness section, and, you know, they got a lot of funding during COVID, so they gave us some funding for that. But we just recently, or we are in the process of packing up about, I think EBHB said they needed about 2,000 kits. So we're in the process of packing up about 2,000 kits to share with EBHB because we had that additional funding come in. So we're able to do that. And Ivy, I saw you come off mute. Did you have another question about that?
No, my question was about the funding, how it was.
Oh, yeah. MCHB funds, and then we went begging. We went begging, and EP says yes. So we were like, yes, we'll take it.
We looked at that recovery money funding from McVie as part of it too.
Great, thank you guys so much. We have about 10 minutes until we're going to close out the workshop Zoom. Does anyone else have any questions for our fabulous presenters?
I kind of want to ask a question. Oh, go ahead.
You can go ahead. I've asked one question so
far. Okay. Well, I feel like sustainability is what we always hear when we're talking about like program management, especially within MCH, and even just like the workforce, just finding ways to make it sustainable, finding ways to make sure that it lasts. And so with your experiences with the CHAMP program, I kind of just wanted to know, you know, and especially after COVID, during COVID, how or what advice would you give in terms of finding ways to make programs more sustainable, finding ways for them to last? And yeah, so what advice would you have to give with that?
Carla, you want to start or?
Well, I was sitting here thinking, I guess to take the lessons, I mean, I've been around for 50 years almost in social services. And it took going through a pandemic to know to plan ahead. So lessons learned, the emergency preparedness, we need to do that now as routinely, just like Jackie said, it needs to become routinely incorporated. The other thing we did is involve those funders to know what was going on with our TennCare. We get TennCare funds for CHAMP. It's the primary funding source, so it's 2/3 of the money. We notified them up front and got them to modify our contract to say that our TennCare staff, our CHAMP workers, could be reimbursed salary-wise for work they did on COVID. So I think that thinking ahead and getting those kinds of concessions or being prepared to roll pretty quickly on funding, because without, McVie would not allow anyone with McVie who was funded with McVie money to do any COVID activity, but TennCare had that flexibility. So I think it's trying to know ahead of time the things that are going to happen and make an emergency preparedness plan. Jackie was really good on this, and Leilani too. There in Shelby County, their staff not only went out, they had the large staff, but you've also had families who had COVID, and you had multiple scenarios going. We wrote a contingency plan and had in place at our state office how we could step in if a county's COVID impairment became so great that they needed the support of us to do applications or to talk with families or whatever it had. But I do think we've got to not sit back and say it's over, but to take the lessons we learned on prompt response, on going ahead and building emergency preparedness in so that it doesn't go away.
And I would just evaluate, just add to that consistent evaluation, assessment, looking at your processes, determine what's working, what's not working, and not being afraid to toss it if it's not working, and not tossing it just for the sake of tossing it, but having something else in place that you can move right in. And so we're in the process now of trying to do some QI and to just try to look at, what we have done, what we're able to continue to do. And if it's things that we've done in the past, like everything for these programs was paper-based. For those that required applications like CSS, all of those, we required applications, we required family service plans, transition plans, everything was paper-based. So moving from a paper-based system into an electronic format and continuously looking at HIPAA and making sure that we're in compliance with all of those rules and regulations that go along with these type activities, but just making sure that we have a way now that, so if all the paper's blown away, that's good. We still have a way to maintain and to continue to do our work and to continue to serve families. So looking for those opportunities to move beyond what's traditional and what we normally do into that new arena, and then being able to sometimes sell it, because sometimes you got to sell it, because we have people that for many, many years didn't want to do the paper applications, but when we moved to electronic format, it was like, oh no, what do? We don't, and so, and now we, well, we got to file it and we need to print it, and no, you don't, and so but continuously evaluating and assessing what's going on is what I would say, helps a lot, and not being afraid to change, not being afraid to move forward.
I have a question regarding the CHAMP care coordination, like pre-pandemic and during the pandemic and then following, I guess. Do they did I hear you say that they do home visits for the care coordination?
Mhm.
And then, like, what's going on now? Has it been limited? I know the pandemic
Mhm.
is kind of like comes and goes. So
So prior to the pandemic, for Children's Special Services, home visits are required. And so we wrote that into, when we meshed those guidelines, that's part of the guidelines. And so, and Chant families that are not special healthcare need families can also receive home visits. They're not required for that population, but they can receive them. During the pandemic, all home visits were discontinued. We started out the first couple of weeks like we were going to continue to do that, or we were going to do this. All home visits were discontinued. And then last year, when we had that first lull and thought we were getting back to what everybody said was a sense of normalcy, then we actually put out our new home visiting requirements. And so did that probably June last year, and then had a new surge and had to bring it back in a little bit, but we're moving forward again with requiring those home visits. And it could be, you know, on the porch, it could be in the yard. It doesn't have to be inside the home. And then of course, putting some things in place, like we call the families ahead of time and find out, is there anybody there that has symptoms? Have you been diagnosed with COVID? And those kind of things, and just trying to put a safety mechanism in place.
thank you.
We got another question in the chat here. Are there plans to collaborate with the birth defects surveillance program?
So I actually oversee the birth defect surveillance program as well. And right now we do receive referrals from the birth defect surveillance program. But as far as any other type collaboration, we're not doing that at this time. And I'd be interested to know what type collaborations that, you know, suggestions you may have for that beyond the referrals. We do referrals and follow up for those families with birth defects.
We can probably take another question or two.
So I'm going to have to jump off. And so
Oh, no
if
worries.
you have a question for CYSACN or like the beginning of chant, I'll stay on for a minute, but I have the why session that I have to get in and try to get to. So
Thank you so much for taking
yeah.
the time to be with us today.
Thank you all for joining in and for, you know, engaging with us and asking all the great questions. So thank you very much.
Thank you. Thank you, Jackie.
Thanks, Jackie.
Going once, going twice. Well, I thank you all for being here today, and a special thank you to our presenters. Oh, no. Yes, thank you. Salame beat me to it. Well, thank you everybody for joining us today. We are going to conclude our workshop session today, and we hope to see you at some other sessions throughout the week. Thank you.
Thank you.
Thank
Bye-bye.
you all.
Have a great day.
Bye-bye.
Bye.
Bye-bye.